How often have you seen incorrect manual handling being performed on the wards? Hi, my name is Brenda Keys and I would like to present a slideshow based on correct manual handling for patient safety and a healthy workplace. In this presentation, I hope to discuss and educate my peers on where to find the best resources in order to provide the safest care to our patients. I would also like to present reasoning behind good manual handling and what can happen if it is done incorrectly. As new graduate nurses, it can sometimes be difficult to speak out when we see something being done incorrectly, especially when that person is someone superior. Therefore, I will also present some evidence-based techniques on how to escalate a situation in a professional manner with our colleagues. My reasons for choosing this topic is because I have a passion for protecting both my colleagues and my patients. I want to lower the risk of harm and facilitate their recovery and growth. So, why is incorrect manual handling for patient and nurse safety such an issue? There is no denying that the Australian population is rapidly ageing. With these statistics, we can expect a lot more high dependency patients presenting to the wards. High dependency patients need a lot more of our time because they have reduced mobility. Manual handling is incorporated in nursing right through from how we push a wheelchair to helping a patient turn whilst in bed or standing up. Manual handling techniques have improved a lot over the past few years with the invention of manual handling aids. Before this, musculoskeletal injuries were extremely common in the nursing profession. What is currently being done about this? Currently, there are numerous policies and procedures in place in order to prevent injury or harm to both patient and nurse. There are also face-to-face mandatory manual handling teaching days in most facilities. The harsh reality of it is that quite often nurses cut corners in order to get tasks done faster. For example, a patient that is bedbound with limited mobility has slipped down the bed slightly. They need to be a bit more upright in order to have some lunch. This is a very common scenario on the ward. Instead of using the proper manual handling techniques and aids such as a slide sheet, they use the bed sheet to pull the patient up the bed. This may not cause significant injury to either patient or nurse at that time, but the potential for harm is definitely increased. Repetitive strain injuries can occur when doing these motions every day over a long period of time. As student nurses, the majority of us have already seen this type of behaviour and maybe went along with it because we feared the nurse would be angry, or maybe we just didn't have the skills at that time to know how to approach the situation. Why is this a significant issue to contemporary nursing practice? This type of behaviour is a significant issue in contemporary nursing practice because it can cause significant harm to both the patient and the nurse. The last thing the hospital needs is nurses being off sick due to an injury that could have been prevented, or risk being sued by a patient due to a longer stay in hospital from an injury or worse, death. These expenses could be going towards medical supplies instead. It is well known that the nursing profession and chronic back pain have an extensive history. The older nurses who did not have policies and procedures to follow years ago are now the ones with back issues, telling the younger nurses to look after their back. These nurses are the ones who advocated for both the patients and nurses in order to protect them from harm. It is because of them that we now have policies and procedures in place. So why not follow them and learn from past mistakes? I have been lucky enough to work in aged care for an extensive period of time. Because of this, I have had the moral courage to ask nurses why they choose not to use the proper manual handling techniques. Most of the answers I got were that they did not have enough time. Time management and patient load can be a massive issue in many facilities. The high stress environment alone causes burnout and the use of mental health days. Nurse to patient ratio is something that has been a controversial topic lately. But this is no excuse to not follow policies and procedures. If we were jetting off somewhere on an airplane with our family members, we wouldn't want the pilot to cut corners in order to save time, would we? They would be putting us and our family members at a higher risk for harm. What type of harm could improper manual handling cause to our patients? Sure, most of the time we might not harm our patients. Just like if we make a minor drug mistake, they might not have any serious side effects, but that doesn't mean we should purposely do it. Most injuries could be pawned off as being due to having frail bones, such as osteoporosis, or that the patient had a fall. Injuries such as dislocated shoulders from pulling a patient from under the arm to stand up, dislocated hip joints from turning a patient incorrectly or with significant force, skin tears due to incorrect transfers, not using slide sheets, and improper use of lifting machines. One of the biggest issues in hospitals are hospital-acquired infections, most of which enter the body through a break in the skin. Why would we want to compromise our patients further by giving them a preventable skin tear? How can effective leadership resolve or mitigate the problem? Effective leadership can definitely mitigate this problem. Through practicing correct manual handling skills at all times and through encouraging our peers to do the same. This may cause some conflict between peers, especially when we are faced with a colleague who replies with, "This is how we've done it for years." As new graduates, we need to be armed with the skills and moral courage to challenge this culture so we can ensure our patients are safe, and even when we are not the nurse taking care of them. Approaching our colleagues in a professional manner and asking what their reasoning was for doing something is usually a good step to start off with in these situations. Presenting the nurse with the current policies and procedures may also be beneficial. This can sometimes lead to hostility. If this is the case, then approach the nurse in charge and notify them. We work as a team, therefore each patient on that ward is our responsibility too. As new graduate nurses, it is up to us to lead the way by example. This will then influence our peers to do the same. What is legally expected of us as new graduate nurses? In most facilities, there are guidelines on how to deal with conflict. For example, as a new graduate nurse, you are asked by your peer to transfer a non-weight bearing patient to the commode without the use of a standing lifter. You ask them why they do not wish to use the standing lifter, and they say that it takes too long. You tell them that you would prefer to use it as you could injure yourself or the patient. The nurse then tells you to leave and send in another colleague who transfers the patient without the standing lifter. There was no significant or obvious harm to the patient or nurses. This situation can be easy to turn a blind eye to. Yes, the new graduate nurse successfully saved her own back, but she did not advocate for the patient. Although this new graduate nurse asked the other nurse why, she did not escalate further. This type of behaviour may not be deemed as intentional abuse, but it is in fact abuse, and as an advocate for our patient, we should protect them through mandatory reporting. If our peer does not change their behaviour, according to the New South Wales Conflict Resolution Flowchart, the new graduate should have went to the nurse in charge for extra support, and if that did not resolve anything, then follow the chain of command until the issue is resolved. So, what can we do as new graduate nurses within our scope of practice? As new graduate nurses, we can stand together for support and each have the moral courage to question something when we know it is not best practice. When we know that what we have been taught is the most current and up-to-date evidence-based practice, We have the knowledge behind us to support our reasons for changing the culture. The future of nursing is in our hands. I hope you've enjoyed my PowerPoint presentation, and thank you for your time.